show you how to correct for an SIJ, which is sacroiliac joint dysfunction, when you're out of alignment. This is for my patients that I tell you when you're kind of wishy-washy all over and we're not sure what direction you're in, how to do a shotgun technique. So a shotgun encompasses all different directions. So it's a quick fix. It's most effective the minute you feel out of alignment, or within that first 24-hour time period. After that, it would most likely require our manual skills because you have secondary muscular spasms. All you'll need is a yoga block or something sturdy and stiff like a yoga block, and a belt or a strap that is not stretchy. Do not use anything elastic because it's going to prevent you from having that contraction that we're going for. What you're going to do is you're going to lay down on a bed or on a firm floor. You're going to place the yoga block, let me turn so you can see, between your legs. Depending on your width and size, you might need to do it this way if you're broader, but you basically want to keep your hips in a neutral position, which is your knees in line with your hips, in line with the rest of your body. You're going to take a belt or a strap. You're going to either tie it around or just loop it through so that it's nice and firm. And you're going to hold that end or belt it so it doesn't move. So you're basically holding yourself in this position. You're going to lay on your back, anchoring that belt or strap. And now you can't move from this position. You're gonna contract your abdominals, your lower abs, and by pressing your back into the floor or the bed. And now what you're gonna do is a maximal contraction, squeezing your knees together for about 5 seconds. So I'm squeezing the yoga block. And then you're going to immediately try to pull your legs apart and abduct. And you might get just a slight movement, hold for 5 seconds, and you're gonna go back and forth 5 times holding it. And it should be hard enough, like where you hear me losing my breath a little bit, because you want that maximum contraction. Once you're done with that, stay on your back. And now you're gonna proceed with your exercises, which is all your core workout, where you would start to just engage the pelvic floor, and then you could even go into your bridges, or you can do your clamshells with a resistance band, or your bridges with a resistance band clamshell, but you would then basically follow your program. You can see if you corrected by standing in front of a mirror, putting your hands on your ASIS, which are those hip bones that stick out, and seeing that they're in alignment, just like this. If you find that one hip is back, you can keep repeating the procedure. You could also try throwing some heat on before you do this to relax the muscles, to allow that pop that you may hear or feel when you do the procedure. If this doesn't work, give us a call. Take care.